Oftentimes we call our clinic the last resort clinic, simply because we have people that have been everywhere. They've tried everything. Last year, one of the biggest things I can remember was I had a nurse in here. She ran a medical clinic. She was actually 72 years old, but she was still running the clinic, not because she had to work, but because the clinic really needed her. Her skills were great. The problem with her was her back. She had severe back pain, and she had sciatic pain going down both her legs. Now, when you see someone come with sciatic down both their legs, sciatic pain is the great sciatic nerve, and pain in the great sciatic nerve going down her legs on both sides. She'd had this for 7 years. Now, her back was extremely painful. It felt like 2 daggers being shoved right into her back here. And the interesting thing was, of course, she was standing like this, hands on her thighs, forward in this position. Whenever you see people doing this, or if they get up out of a chair and they'll go like this, they'll try to climb up on their body to get out of a chair, and they'll go, oh, 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 and then they'll be just about like this. They cannot bend back. That is a classic indicator that the last vertebra in the lumbar spine here has been driven forward or has slid forward. This is called a spondylolisthesis. Big word, name is not important. What it means is when that vertebra goes forward like that, it drags the disc with it, causing a secondary disc involvement, and that causes this sciatic pain going down both legs. Normally, a true disc problem, you'll see one leg having sciatic pain on it, the other one's fine. In this case, oftentimes, you'll see it down both legs. This particular nurse was examined by the people that she works with. They told her that her uterus was the cause of her back pain. It was pressing against her sacrum, so they removed it. They created a hysterectomy for no reason because there was nothing wrong with her uterus, and by the way, the pain was still there. So she went to an orthopedic surgeon who told her it was her knees. They did knee replacements on both knees. They were perfect knees. She said they told her there was nothing wrong with them, but they believed that's what was causing the pain. So now she's almost totally crippled from these 2 knees. She's in my office. She's desperate. And all I did was lay her on her back and used a chiropractic drop piece and popped her vertebra back into place. Immediately she stood up straight like this. She got off the table, stood up straight and said, "I have no pain." I had her come back 2 weeks later to check her. She still had no pain. She was straight up. I checked the spondylolisthesis with a physical examination, found it was no longer there. It had the adjustment had held its adjustment, and I never saw her again. She was in literally 1 visit. She was in my office and we fixed her. I had to fix her that day. She was in excruciating pain. And with all of these misdiagnoses, it's no wonder why people are driven to the competition of the medical profession, which happens to be chiropractic. There is no other competition for them. The competition is us. So I'm Dr. James Perkins. I'm a chiropractor and a naturopath. I'm with Alternative Health Solutions in West Bloomfield, Michigan. I'll see you soon.